And mental health is a big service right now that's starting to open up as Ontario is opening up in phases. I'm happy to have Alan Stevenson, the CEO of CMHA in Lambton-Kent. Alan, thanks for joining me today.
Thanks for the opportunity to talk to you and your viewers today.
So I got to ask you, how are you doing in this very interesting time in our community, province, and the whole world for that matter?
So CMHA is doing pretty well, actually. As you know, we have been open throughout the course of the pandemic. We did move primarily to virtual services, although not exclusively. We have had face-to-face services, a variety of them throughout the process. We are finding that people were very early on sort of hunkering down, thinking they were going to get through this and everything would be fine at the other end, and have come to the realization that there really isn't another end, and that it's a new way of living, and much has changed. And so we are seeing some increasing demand. More people are letting us know that they need some mental health supports, and so we're wanting the community to know that we're very much open for business and here to provide those supports as they're needed.
That's great. We're seeing Ontario opening up in phases. Obviously, we're going to see some virtual services still in place, but people that are needing those one-on-one services up close and personal, obviously with some social distancing, what kind of services will slowly be available in person? And and then right down the middle, what are the virtual services that are going to still be kind of available as we get through the COVID-19 pandemic?
So what we've learned in the last number of weeks is that for many people, virtual services are preferred. And from a health and safety perspective, virtual services do enable us to ensure that we can keep our staff safe, that we can assess and make determinations about face-to-face services. And so going forward, that will continue to be the case. We will continue to screen for COVID symptoms and for risk over the phone and virtually. And many of our services will continue to be provided primarily virtually. But over time, and we've seen it already, as folks who are struggling more have required more face-to-face services, we have been increasing that. And so particularly you mentioned in Chatham-Kent, housing and homelessness. That's one area, for example, we've been involved in face-to-face services all the way along, but increasingly lately, as we want to ensure that people are who are well housed are getting the supports that they need to remain well housed. For one example, but as well, other services like psychotherapy, where there is a need for, much of psychotherapy has shifted to virtual care, but as you know, we see with the conversation between that client and that staff member that there is a need for an in-person visit, then that will increase as well.
You kind of touched base on some of the programs that are being utilized the most. Is there a certain program that's getting the most workload that you've seen before and now during kind of COVID-19?
Yeah, certainly. And this is borne out in research across Ontario, across Canada. What we're seeing is, not surprisingly, that many people who have never identified having mental health problems before, or challenges, or have accessed formal services are now reaching out for services. And it's the accumulation of a high level of stress and distress, unknown about the future, the impact of physical distancing and loss, in many cases, of good, important social connections. That's creating compounded stress, increase in anxiety and depression. And so really what we're seeing is a real increase in the number of people who need that reassurance, that need some support, that may need some resources, some skill building and counseling, much of which can be delivered virtually. And we have a lot of different options, but that's really what we've seen as a significant increase. And that's really been in the last 5 weeks. Prior to that, we saw actually a reduction in those sort of calls from the general public, but in the last 5 weeks, it's been steadily increasing. And it's really important that that the community know that we're here to offer that. That we really would rather, if somebody is feeling a level of distress that they're finding they're having difficulty coping, don't wait longer. Don't feel that you need to be in a crisis or an urgent matter. We can actually provide support and resources earlier on. We know that early identification and early intervention actually leads to better outcomes more quickly. So we really want the community to know that we're here, that they just got to call, and that we will do our very best to link them to the appropriate service.
Yeah, I think during these almost 2 months that every individual is facing what I would call, the need for socializing, whether they're isolated or not. So you kind of answered, the challenges that a lot of us are facing during
Yeah.
COVID-19. But we got to turn this into a negative into a positive. The thing around Chatham-Kent we've been calling is good news stories. There's got to be some good news stories coming from you and your team. Do you have anything that you'd like to share?
Well, one of I think the things that I'm so delighted about and supportive, and really impressed with in Chatham-Kent is the level of collaboration that it was always there, but that strength of collaboration between different service provider organizations, different health and social service agencies, that bench strength of collaboration has really enabled us to move quickly, and mobilize together to provide support. So, for example, with the implementation of the temporary homelessness shelter in Chatham-Kent, which has been such a remarkable, fast, extremely well done project, the collaboration that has occurred has enabled us to bring mental health supports to those folks who are vulnerable and in need. And in turn, we've been able to support, from that homeless population already 6 people into permanent housing. And so, had it not been for that level of collaboration, those great relationships that already existed, and that willingness to work together, that is really neat in Chatham-Kent, we wouldn't have been able to even identify those individuals and help them to achieve permanent housing. And that's just one. There's lots of examples, but that's one that really sticks out.
Absolutely. As a community, we banded together during COVID-19. We actually had a great interview about the temporary shelter with Polly Smith. And it's great that you guys are such a great partner working with this. And it's amazing that we've all kind of banded together to get through this very interesting time. So I got to thank you and your team for doing what you're doing to help those individuals and families in need. Alan, is there anything else that you'd like to add as we wrap up?
No, Eric, just thank you again for this opportunity. Really appreciate the support that you're providing to the community as well. So great job, and thanks.
No, thanks. And I gotta say, after this is all said and done, I hope we can all celebrate with a big CK block party to celebrate all the hardships we've endured, because we all deserve it.
CK knows how to throw a block party. There's no question about that. All
Thanks.
right, thanks, Eric.